All right, welcome to the VA and Medicare Patients Question and Answer webinar. I'm Tom Ryan with Provider Outreach and Education. I'll be your presenter today, and I'm going to answer your questions. Today, I'm joined by Mary Sue Gardner. She's one of our clinical staff, and she's going to monitor the chat. She may also have to jump in on some of the more clinical questions in nature in case there are any of those. I do have her standing by. She will be asking me questions that you put in the chat. For this webinar, that is our primary goal, is to get through all the questions you've already submitted and then what you need to do. This webinar, though, is this webinar is focusing on those people who work with Medicare and VA and whose Medicare recipient has VA. We are not going to talk about how the VA bills or anything like that. That is a VA question. It is focused on Medicare patients with VA coverage, and we'll talk more about that as we get into it. Couple of housekeeping things. Again, just as a reminder, there is a presentation that goes with this. It is available on our live events page. Please feel free to download that if you would like to. The live events page is in there. On this slide, you'll see the training center because we want to remind everyone that we are going to record this and put the encore presentation onto the training center. The encore presentation will be available for 60 to 90 days, and it will link to YouTube. YouTube will actually maintain the presentation for a longer period of time. So please be aware of that. Please put your questions in chat. I can't help you if I don't know what questions you have. Don't hold the question. As it comes to your mind, add it to the chat. We will get through those. I have built a presentation based on the questions submitted during registration. So that presentation and the information contained within it hopefully will answer all of those questions and maybe even hit the question that you have. Afterwards, we are going to ask you to complete a survey. This question and answer session will hopefully be able to get you the information, but we want to know how well we did. I need to know what you missed or what you didn't get, what I could have done better. Did the resources and the PowerPoints help you? And overall, how is WPS doing? So I'm going to ask you to do that at the end of the presentation. I'll get more in for that. A couple of things to keep in mind. First, this is a tool to assist you in the provider community. Medicare rules do change often. Now, luckily, the Medicare VA rules are fairly static, but it doesn't mean that some of the billing questions and other concerns haven't come up frequently. This webinar was done as a secondary schedule event. The primary event, we did a full 1 hour webinar on the information, and then the questions were very long, and so we had quite a few of them come in. So we did schedule a secondary event for that, and that's what this question and answer session will be. Now, with that said, the answers given for today are based on the facts and the questions. We had a lot of interesting questions come in. I've tried to interpret those as best I could, but if I did not get it right, please put the question back in chat or give me clarification in chat. It's the only way I can help you. Also remember that the Medicare rules determine final coverage even with the VA. So when you're talking about what the VA does and what Medicare does, they're two different federal entities. The Medicare rules will always determine the final coverage for the Medicare recipient when billing Medicare. And you have to follow those rules. We'll talk more about that. Access those rules on the CMS website. I will give you a couple of different items from the CMS website to help you out today. What is our agenda for today? Well, I want to have you gain an understanding of the Medicare requirements when the patient also has Veterans Affairs or VA coverage. This means, is it the patient's choice for coverage, and what does that mean? When you will bill Medicare or the VA, so which one will you bill? And then the VA and Medicare with primary insurance. It is not the VA as primary insurance or Medicare as primary insurance to the VA. It is when there's a third insurance involved. And we're going to talk about that because there was a lot of miscommunication and confusion over that particular agenda item. Let's start with some basics on coverage. One thing I want you to remember is that we are not talking about Part C or Medicare Advantage plans during this. I had 4 questions specifically gauging whether or not the VA and Medicare Advantage work together the same way as traditional fee-for-service. They do in some cases and they do not in others. Because the coverage for a Part C plan is based in the individual plan, the type of plan that it is, and there are a variety of types of plan, it doesn't work exactly the same way as with the Medicare traditional fee-for-service. Yes, they do have to cover the same things as fee-for-service, but they don't necessarily have to cover them the same way. There are also plans that are specifically designed for people who have VA coverage that work solely with the VA. So that's your first question. We're not going to get into all of the explanations of the Part C plans in VA. Okay. So let's go ahead and talk about coverage, but let's start with a couple of questions you asked. First, who covers Medicare or the VA? Second, does the VA cover Medicare patient liability? So let's start with who covers. It is not Medicare and the VA, it is Medicare or the VA. The key thing there is the word or. If the VA makes a payment, Medicare will not. Now, when we look at inpatient and outpatient services, it is different, and we will provide a slide to answer that question in a little while. But remember, the basic rule is no two federal programs can make a payment on the same service. We'll talk about that. The second part of that is, does the VA cover the patient liability? Well, the Medicare liability is not the VA's coverage. Normally, the only time the VA would cover is if they authorize a service, which would be excluded from the Medicare patient liability. So I don't want you to think it's one or the other, or it's one and the other. It's not a supplemental insurance. It's not a primary insurance situation. It's or, one or the other they have. So how does that work? Well, it works with two federal programs. There's actually a federal law that says if one federal program pays for the service, the second one cannot. Well, why is it one or the other then with Medicare? If the VA authorizes the service, they do not leave a patient liability. Therefore, Medicare has nothing to pay. The VA will either authorize or not authorize a service for non-VA providers, which is what we're talking about here, non-VA providers. If they do not authorize it, they will not make any payment. And if they do authorize it, they're going to pay it at 100%. That's why it's either the VA or Medicare, but not both. Because otherwise you would be receiving double payment under the two federal programs, and that's not allowed. The next question we had come in was about questions for filing and whether or not how the signature works for that. So keep in mind, there are statements that you can write and they can be written a little differently. And so we don't have a direct answer for this one. Instead, we have a multi-part answer. So first, yes, the patient does have to authorize you to file claims. Yes, a general authorization would work in this case. That doesn't change. That general authorization would allow you to file to either one. So if the VA were to deny it, then you can automatically file to Medicare. There are also some patients that will only allow you to file to VA or Medicare. That is their choice. The patients have the right to do that. And in that signature document, it may contain that information. Should they change their mind in the future, you will need to document that change of mind and then get a new signature accordingly the next time you see them. All of that has to play together. Now, keep in mind, if they do not authorize you to bill Medicare, that means that they are liable for whatever the other service is. So if the VA says it's not a covered benefit, or we do not have an authorization, that means that Medicare without that authorization is not responsible. You can't bill us. That's part of the authorization process. That's why we have a lot of times where you'll see the signature on file card, the SOF on file, and you have a statement that allows for both. That's why this is the most common billing practice and the most common signature practice, okay? So keep those two things in mind. Look at what the patient is telling you. Next question, can a patient request that with their signature on file, only certain services be billed to Medicare or the VA? And the answer is absolutely. A patient at their request can say, don't bill my insurance, Medicare and the VA, or only bill the VA for, or only bill Medicare for. That's all their right. This is their benefit. So follow their signature, follow their guidelines, have them sign off on it, okay? Now, with that said, one of the things you've heard me say multiple times is a statement allowing both. If the VA does not pay, they deny for no authorization, you are not following the double billing guidelines. You're not double dipping. You're not getting two payments from a federal program. You're getting one, and that may be the Medicare primary payment. So we'll go into that a little bit more because that leads to our next question. And the next question is, why would someone want both? Well, sometimes it's not about wants. Why would someone have both? They've earned them. Right? The VA is a benefit given to people that have served in the military. If at certain times they have a certain number of years, things like that, then the VA can authorize them to either use a VA facility or an outside facility. Again, that's not something we can advise you on. What we know is it's either VA and yes, they've authorized it, or no, it's not. Medicare, on the other hand, is something that you work for. You pay in the Federal Insurance Contributions Act. If you've worked 1 quarter in a lifetime, you're eligible for it. If you work 40 quarters, you get free Part A. You will always pay a premium for Part B. So why would they have both? Well, they've earned it. Sometimes it actually works for their benefit. Well, what do you mean? Let's look at that. One, what happens if they use the VA and it's an authorized service? Well, then they don't have a patient liability. That seems pretty good for the patient, right? Request authorizations for outside providers, though. This one becomes a little tricky because what happens if it wasn't requested or it was denied? Well, that's why they may want Medicare. Yeah, they're going to have to meet the Medicare deductibles, copays, or co-insurances. Yes, we understand that, but it's still covered should the VA deny that service. Sometimes, and we actually have one patient who told us straight out, I will never ever use the Medicare program. Okay, well, that's their choice. It's the VA that they want to use, and that's their right. So it just depends. Now, the VA also can set limitations on payments. It's only for this period of time. It's only for these covered services. It's only if this. That's the VA's right, but Medicare can do the same thing. As I stated earlier, there's also a type of Medicare Advantage plan that works solely with the VA, and that may be an additional benefit program. So one example of that is the skilled nursing facility cares. So the VA doesn't pay for some of the long-term, some of the inpatient rehab care in a skilled nursing facility. It's not something that they always pay for. But because of that, there are Medicare Advantage plans that offer that as a supplement to help them out. Now, again, the patient would have to then choose that particular Medicare Advantage plan and have to follow those rules and guidelines. It's not something to do with traditional fee-for-service. So when we answer the question of reasons why someone would want both, imagine if you can protect yourself with having double coverage. When one doesn't cover it, the other one will. Well, that seems like a really good reason to have both. Also, there are times when you're actually going to have more coverage by having both. So again, that's the reason. Now, I can't tell you on an individual person why that person wants to have both. That's their choice. I could also tell you they don't have to have both billed. That's their choice. So please keep those things in mind. Another question that was very interesting for me was the question of non-covered. And this one I always find interesting because non-coverage can mean a variety of different things. I'm going to answer the question in the way that I believe that it was asked. So if there is a non-covered service, who do we bill? Well, always remember that if it's a non-covered, it is the patient liability when the VA and Medicare do not cover it. If neither one covers it, it's the patient's liability. They're outside the federal benefit program. In other words, the law says no. For both, it's the patient. Sometimes they are patient liability when the VA covers, but Medicare does not. And that depends on how the VA covers it and the reason that they're covering it. So they may cover 3 days of this, but they're in for 8 days. Well, the VA authorized 3, that means there's a portion of liability that would be the patient's. That has nothing to do with Medicare. Medicare says, hey, our payment system doesn't allow that at all because the VA made a payment. So help me understand. Also, there are times when Medicare may cover a service and the VA does not. In that case, you would bill the VA or you could get a denial from the VA. Sometimes you can tell the patient, the VA is not going to cover this, and the patient will say, okay, don't bill them, just bill it straight to Medicare. And that's okay too. So it really depends on the type of information. The other question is, can a patient have supplemental insurance with Medicare and the VA? And the answer is absolutely. There's nothing prohibiting them from having any supplemental insurance for a non-covered item or a covered item. That supplemental insurance can offer additional benefits. That is not something that we're involved with. Yes, they can have it. Now, if your state has a regulation or something in place that is different, that is a regulation that you have to follow based on your state. It is not something Medicare will be involved in. The reason that I put that quid pro quo in there is this person actually cited a state code that says that they cannot have a supplemental insurance based on some following criteria. Again, that is a state code. It is not a Medicare regulation. We are unable to advise you on that. If you need advice on that, please contact legal counsel. The next question was regarding receiving outside orders from the VA, and I think that's the terms that they're trying to say that Yes, the VA ordered them, but would Medicare recognize that VA provider? Now, the reason that this one came in has something to do with a claim denial. I don't have the claim number and I don't have the specifics on it. What I can tell you is this. VA providers can enroll in Medicare. They do not enroll in Medicare as billing providers. They are not able to bill Medicare. The VA program pays that benefit. So why would they want to enroll in Medicare? If they enroll in Medicare, we are able to establish through credentialing that they have the right to order or refer for a Medicare service. This is ordering and referring only. They are then eligible to be an ordering or referring for an outside entity, such as those of you probably on this call today. They can order an inpatient care stay, they can order observation stay, they can order diagnostic tests. Any of those types of things, they can sign off on plans of care for physical, occupational, speech language pathology, any of that. However, if they do not enroll as an ordering and referring provider, they may not be eligible for any of those. So when your record gets pulled and we don't know who this is and we don't have them enrolled as an ordering and referring provider, it is a different situation. I did receive a question from someone who, I don't know if they're actually on, but they actually work for the VA. Their question is very specific about being an ordering and referring provider and how do they do that? There's two ways you can do this. If you want to enroll with the ordering and referring provider criteria, I put these on the slide for you. One, you can enroll through the provider enrollment chain and ownership system. There is an option to say that you are a VA provider. And that option will allow you to complete basic information and to get us that basic information. There is also a form, and it's called the CMS Form 855-0. It's not the 855I. Cross that one off for you that work for the VA. It's the CMS Form 855-0. It's much easier to fill out. It does not have the same information, all of the same information as the longer 855I. That form you must fill out and complete if you choose not to do it electronically. Take your pick, but we do need you to enroll in some way. Otherwise, all the other providers that you're sending someone to on an off-campus VA will not get paid, okay? The next question is very specific to Medicare. And what happens if they do not have Part B coverage? So for those of you that are not aware, Part B coverage is an option that someone elects. If they do not have Part B coverage, what happens? First, the VA will still cover it. It doesn't affect VA coverage at all. But should the VA deny it for any reason, if Medicare Part A would cover it, now Medicare Part A is our institutional inpatient insurance, then we would consider it as primary. If it would fall under the Medicare Part B category, so outpatient hospital or outpatient facility category, if it would fall under suppliers, if it would fall under professionals, then they will not be covered under Medicare and you will be denied. Someone asked, in this case, could they have a supplemental insurance? Again, that's not something Medicare can comment on. As far as we know, they can. So this one gets a little bit interesting when you talk about that because we really do have to look back at the eligibility files for Medicare to establish whether or not they have both Part A and B. All right, which brings us to billing. Let's go ahead and just cover a little bit on billing. First, this is not a how to build a VA course, though I had several questions on how to build a VA. If you have questions on how to build a VA, contact the VA. We can't advise you on that, okay? What we will first start off with is the most common question for this class. Whom to bill for a veteran? And can we bill the VA and Medicare on the same date of service? So, whom to bill? Establish whether the VA will cover the service or not, but follow the guidelines from the patient. They will tell you whether or not they want you to bill both or even question both. Then look at what's best for the patient. Typically, it's going to be the VA coverage. That's normal. So if they say, yeah, we don't care who to bill, okay, did the VA authorize it and will they pay for that service? If they will, bill them. Now, what would they pay for that may not be authorized? Emergency room care is an example. An ambulance transport for an emergency, another example. They aren't requiring authorizations for that in some cases. So can we bill both Medicare and the VA for the same date of service? Again, my answer falls right back to the basic question. Did the VA authorize and pay or not? If they didn't, yes, you're going to bill them. If you get a denial, you'll bill us. That means you billed them for the same date of service for the exact same service. If you bill Medicare by patient choice, should you bill the VA? Tell me what the patient wants, but I will tell you that if the VA does make a payment and they pay it at the 100% amount, you may have to refund Medicare, even though that's what the patient chose, because the VA is considered paid in full and they left no patient liability. So you do have to follow the different guidelines there. So key things when billing the VA, things to really consider. One, is it a VA authorized service? If it is not a VA authorized service, then they will not pay. If it is a VA authorized service, they've been paid at 100%. Therefore, there is no Medicare liability, which means that if you bill Medicare first and then the VA and they will end up paying it at 100%, you owe Medicare money. Hopefully that answers the question about refunds as well. Now, the other question is, are there emergency services that do not require prior authorization? This is a question for the VA. We are aware that there are some times when emergency services do not require prior authorization, only we can't give you a list of those. We just know that it does happen. So I wanted to make you aware of that. Here is a bunch more billing questions. So how to bill the VA? I don't have an answer to that. We aren't the VA and we can't tell you how to bill them. You want to make sure you're following their guidelines. Does the VA process or allow secondary claims? I don't know. As a secondary, I would assume so, but you would have to ask the VA that question. Medicare does allow secondary claims, even when the patient has VA coverage. So if they were in an auto accident, you could bill the VA and they can say it's not authorized, but you already have liability insurance on that from a car accident. You can bill Medicare for the secondary portion as well. Hopefully that does make sense. For the most part, as far as we know, the VA does not allow secondary claims, but again, I don't work for the VA, so I'm going to tell you, contact them. Again, for the most part, they don't allow it. Do they pay, does the VA pay the rural health clinic all-inclusive rates? The answer is the VA payment methodology is different than the Medicare payment methodology. They do not follow the quote unquote all-inclusive rates. They have a different system and a different set of payments. So please make sure you are aware of that. So when it comes to questions like these are not something we as Medicare can answer. What we will focus on instead is how do you bill Medicare when it comes from the VA before or after. That's what we can focus on. So again, ask those questions to the VA. They will explain it to you, their benefit program. Different specialties. This one is interesting because if a provider has one specialty and another, and they refer to the VA for a specialty, can they bill Medicare if they're enrolled? Well, keep in mind, it's not really about specialty. What we're looking at is if the VA has that and are they authorizing it? So the VA may say, oh, you need a cardiologist. We don't have a cardiologist. Nope. So it's authorized for cardiologists, go out and see that cardiologist. It's different scenario. On the other hand, they may say, hey, we do have a podiatrist. So you have to see us for podiatry, but outside people for cardiology, and here's those authorizations. So each one is looked at differently. And I'm not sure if I'm answering exactly what you're asking us, because based on the VA authorization is how you would then have to bill us. We do have a situation where the patients have requested that everything goes to the VA or everything goes to Medicare, regardless of the, authorizations and all of that. Follow their guideline. This is the patient's benefit, but then keep in mind, once you do that, you do have to follow whatever happens between both. So if the VA makes a payment at 100% and there's no patient liability, obviously then if you did receive a Medicare payment, you want to give that money back. Otherwise, you are considered having two payments. With that said, could this be put onto a cost report as an overpayment? Sure. If you bill on a UB04, if you bill on an 837I and you're doing a cost report for the quarter and you need to do one for whatever reason, yes, you could add this on there. I don't know any more information than that because I'm not sure exactly what else you would need with that question. Okay, so when would you bill Medicare? Let me explain this and hopefully answer all of these questions, kind of lump them together. Now, I will say there's a variety of questions that came out with Medicare. So I'm going to try to lump them all into one. So first, if the patient doesn't want the VA billed, is that something you can bill to Medicare? Sure. Have they authorized you to bill Medicare? If they answer yes, then that's fine. This one question was, it's a mental health patient who does not have a durable, who does not have a power of attorney. So there's no one acting on their behalf right now. There's not that possibility. Follow what they're telling you. For whatever reason, they don't want something billed as something, that's fine too. Okay? If the VA denies the service as not authorized, can you bill Medicare? Yep, go ahead. As long as you have the signature on file and it says go for it, then go ahead. The VA pays for some outpatient services and not others. This is the same as if the VA has not authorized those services. The thing is, because it's outpatient, it's not a payment methodology like a lump or a bundling payment methodology such as an inpatient prospective payment system does. One payment based on diagnosis, one payment based on. So for outpatient services, yes, feel free to bill those. If the VA denies it, that's fine. Would you want to bill Medicare if there's unmet deductible? And you could potentially do that. I will say if the VA pays it in full, Medicare does not always apply that, especially for Part A claims. Somebody did ask about a Part A claim in a continued benefit period, and do you need to bill that? And the answer is no. It doesn't continue the benefit period. It doesn't use benefit days. It doesn't help us in that factor with the VA being billed because they have different criteria than Medicare does. So a lot of those factors all play into a variety of different things. All right. So let's move on and let's talk briefly about what happens when the VA partially pays a claim. And can you tell me what type of claim it is? Now, I will tell you this person bills on a UB04 or an 837I, which means they are a facility. So on an inpatient claim, the VA partial payment, the answer is no. So they authorized 3 days. They did not authorize the full 10 days. It's partial payment from the VA. If it's an inpatient claim and it's a hospital claim, they are paid under an inpatient prospective payment system, which uses the diagnosis for one entire stay. It's not based on a daily rate. It's not based on that. It's based on the diagnosis. The diagnosis then establishes how much you will be paid per day. That does not mean that you're going to get extra because it means it's a payment. So when we look at the full picture, we want to look at that. Same thing with skilled nursing facilities and other outpatient information. Now, for outpatient billing, when you're actually looking at the primary payment, go back to the basic thing that we talked about in the previous slide. One, did the VA authorize it? Yes or no? Is it an individual service? Because it's outpatient, it's not about the full picture, right? It's not about that. But we also still do have to follow the Medicare payment guidelines for bundling, for inpatient stays, for outpatient bundling, such as the National Correct Coding Initiative or the Physician Fee Schedule bundling. All of those still have to be followed. So no, the answer is when you get a partial payment, we don't waive criteria under Medicare. I'm not sure what criteria you were looking for us to waive, but we don't do that. We also don't waive if there is someone that should have paid in front of us, such as an auto insurance or a group health plan. Those still must be followed. So though the VA can't be billed as a secondary in most cases, but again, if you want to guarantee that, you better call them and find out from them. What you want to do is follow the Medicare guidelines when Medicare is processing the claim. Okay, and that does include partial payments. I think I got all the questions on that one. So if I did miss anything, put that back in chat for me. Inpatient days. Inpatient, Medicare will not pay for an inpatient stay. Remember, the types of payment system Medicare uses is very different than the VA. We do look at things differently. Therefore, the payment methodologies do not work together. If the VA makes a payment, we will not pay. Okay. Now, observation is not inpatient care. Hopefully everyone is aware of that. I did have someone say, well, they're under observation inpatient care. I don't know what that means. For Medicare, it's either observation care, which is an outpatient benefit, or it's inpatient care as ordered by a physician. So I can't have both. Are they under observation or are they under inpatient? Follow the guidelines that go with that. And I was unclear as to exactly what you were asking me for. So hopefully that answers that question. Payments. So again, inpatient, there's a various of the prospective payment systems, and this is why we don't But on an outpatient, we do have to look line by line. And this is key when you talk about claims processing and billing. We're looking line by line to find out what Medicare has authorized, or I'm sorry, what the VA has authorized. Because just like with some authorizations, there may be things that arise that were not on the original authorization or are not related to the VA. You may go into your payment today and the VA authorized you to have this done, but guess what? Now you're covering something completely not related to that. Well, that would be billed to Medicare as well. So it just depends on what's within that. And so outpatient is really the trickier one. Please look back at the authorization, bill it line by line. VA authorized claims, do not submit an inpatient claim. We've already established that. But for an outpatient claim, if you're billing on a UB04 claim form or 837, do bill with condition code 21. No payment claim at the patient's request. This is key. The patient can request that you bill anything to Medicare, and the federal law says you have to bill it. It's just whether or not it's going to get paid, and that's completely a different issue. So if the patient says bill it, then bill it. On the 1500 claim form or 837P, append the GY modifier. This tells us that it's a statutorily excluded claim. It was done at the patient request, but it was VA authorized, which means you've got payment. You're not looking for anything. Now, the statute that applies here is the two federal payments. It's not the medical necessity statutes. It's not the Social Security benefit statutes. It's a different statute, but it's still there. It's still a law. Okay. This will allow you that if the VA does happen to take their money back, you can file a new claim or adjust your claim, removing the GY. So that's why we recommend doing that. So hopefully all of that does make sense. If the VA partially authorizes it, again, follow the same thing. Don't submit for an inpatient. VA did not pay, submit a claim with condition code 26. Key thing here, the VA didn't pay. The patient can request that you bill the VA all they want. It doesn't mean they're going to pay it, just like Medicare may not pay it. Please make sure you put your condition code 26. Outpatient, on the UB or the 837I, you still want to use condition code 21. You can also use modifier GY on an individual line versus the condition code 21. Condition code 21 would affect the entire claim. The modifier GY on an individual line means that you have to bill a variety of services, but the at individual line is not covered versus an entire claim. For the 1500 or the 837P, again, we're looking at that GY modifier. Do you need to get an advance beneficiary notice of non-coverage for a patient that has the VA coverage? And the answer is, well, yes and no. One, no payment from the VA for a statutorily excluded service. Nope, you don't need it. It doesn't even apply in the advance beneficiary notice of non-coverage. Could you get it as a nicety? Sure. On the other hand, for a medical necessity service, you still have to follow the Medicare guidelines. So yes, you could in this case actually have to have one. If the VA denies it as not authorized and Medicare wants to consider it, you may need the ABN to get that patient liability reversed so that they're responsible for it because it was not medically necessary. So it's not exactly an exact science to say yes or no. We have to look at the variety of factors within it. Remember that if it is a not covered Medicare service, meaning it's not part of the Medicare regulations, even if the VA authorizes it and pays it, when you go to bill Medicare, if the patient requests it, use the GY modifier. This indicates to us no ABN is required and it's not part of your statutory program. So hopefully all of that makes sense with that and I didn't miss any of those questions. Specialty care. Clarification on if and when a patient can switch from Medicare to VA during a specific specialty care. Well, the thing to remember with this is outpatient services are a date by date, so they can switch whenever they want from the VA to Medicare. If they say, bill January 1st to my VA and bill January 3rd to my Medicare, and then, oh, nope, I think January 5th should go to the VA, that's fine. It's an individual, unique type. Also, did the VA authorize this? And remember, we've had these discussions. You keep hearing me say the same thing. If the VA authorizes it, they're going to pay it 100%. Therefore, don't bill us. If the patient requests that they bill us, bill it with a GY indicating to us that the VA paid it at 100%, or bill it with the correct condition code, depending on how you bill. Okay. If the patient requests, you're going to hear that one a lot too. Yes, your patient can request that you bill one or both. And you must bill both at patient request. Primary payer situations. Now, this is about when there's another coverage, a third coverage. It's not about VA versus Medicare. So we had a lot of questions that came in that says, how do you bill the VA as a secondary to Medicare? You don't. The VA is not secondary to Medicare. How do you bill Medicare as secondary to the VA? You don't. Medicare is not secondary to the VA. If the VA does not pay as an unauthorized service, then Medicare will consider it as a primary coverage situation, not a Medicare secondary payer situation. Okay. So who's primary for treatment when it comes to the patient having both VA coverage and Medicare? Ask your patient, who do they want billed, and follow that guideline. It is not a secondary situation like what you're thinking or what seems to be indicated during the questions that were asked. I do want to run through a couple of things to make sure that I answer all those questions. First, Medicare primary payer. If there's a primary payer, it has to be a group health plan, and Medicare does divide those into 3 separate caveats, or it could be a non-group health plan, and there's liability and no-fault workers' comp and federal black lung. It does not matter if a group health plan covers or does not cover. That's not what the VA and Medicare are working together for. So please be aware of that. If you have questions, put that back in chat. I wanted to put this in because we did have a few questions just coming up as to when Medicare was primary. So, all right, should I follow the Medicare rules or should I follow the VA rules for billing? And the answer is, who are you billing? Follow their rules. If you're billing the VA, you have to follow the VA rules. If you're billing Medicare, you have to follow the Medicare rules. If the two don't play nice together, you may have to bill the VA in one manner and Medicare in a different manner while noting within the chart why you're billing differently. Note within the chart why you're billing differently. Okay, each one has to go to the other one accordingly. You will follow one set of rules when only one of them will cover the service. So for instance, if you're billing the VA and it's covered at 100%, you don't need to follow the Medicare rules because you're not billing the Medicare for that service. It's covered at 100% for the VA. Okay? So I wanted to make that as clear, but because I wasn't really sure the situation you were talking about there, if you need more on that, please put that back in the chat for me. Medicare Advantage, and we did talk about this. Medicare Advantage is not a secondary situation. It is a situation that is separate from traditional fee-for-service Medicare. You do have to ask the plans for their information. And again, there are some Medicare Advantage plans that are actually designed to work with VA coverage, but I can't answer any questions on those. So that's what I have for you on that. If you have more questions, which you all did, go back to the plans themselves and see what they do with the VA coverage. There was a question that came in, is there some time when Medicare will always be primary? First of all, keep in mind, when we're saying Medicare is primary, we're saying someone you're going to bill after Medicare, not the VA. It's not instead of, it's after. In this case, yes, Medicare would always be primary to a supplemental coverage plan as written as supplemental coverage. Medicaid's the payer of last resort, so of course Medicare is primary to Medicaid. Medigap plans are contracted with CMS to cover things that Medicare does not, such as patient liability, deductible copay, etc. That's all they cover, deductible copay and coinsurance. And TRICARE. Medicare is always primary to TRICARE. For retirees, the question came up, is it TRICARE versus the VA? We can't answer that. That's something you have to take to TRICARE. The other portion that came into this, which was a late question regarding TRICARE, is Medicare primary to TRICARE for an active duty personnel member? And the answer is no. Once they're active duty, TRICARE is their primary insurance. So they could have Medicare for a variety of reasons, but TRICARE is their primary. But the key thing there is active duty. If the patient requests it, when do you bill Medicare versus the VA? And again, look at the patient request. What are they requesting? Is it everything? Is it not everything? What's going on there? But also remember, bill Medicare when the VA denies as an authorized service. They didn't authorize it. They're not paying for it. Bill Medicare. We can at least consider it and hopefully get that patient some coverage. Again, when they are requesting it. So there are times when the patient will say, don't bill my VA for that. That's okay. They have the right to do that. But we do recommend that you document this so that it's understood why you didn't even ask for a prior authorization or why what happened happened. In case someone in the future comes back and questions that, Medicare typically does not question that. That's not something we're going to come back and look at you and audit for. Okay, but there are other federal areas of that will look at that and they will question things. But again, it's not something that we as a contractor will ever look at. Let's talk about ambulance service. When you're looking at an ambulance service, can you tell me if it's covered by the VA? And the answer is no. Here's what I need you to do. Look at the end result and the need for the ambulance service, such as, is it an emergency service and will the VA cover an ambulance run for that emergency service? A car accident, a fall, something like that. Those could be considered emergency services. On the other hand, this is different than a scheduled transport. And that's why we say it the way that we do. We don't know if it's automatically going to be covered. It really is about the type of care that's being done by an ambulance service. So the VA can authorize a scheduled transport. They can authorize a transport to a renal dialysis facility because they don't have that. That's fine. They may cover it at 100% even. Great. They may also not authorize that, and therefore Medicare can then look at it, but then you do need to follow the Medicare rules, which could be the Medicare prior authorization RASNet program. Or it could also mean that you are going to get audited, which basically just means we're going to send you asking for the medical records for it at a later time after it's been billed. Either way. So an ambulance service is not one that we automatically say yes or no for coverage. It's really going to be based on, one, whether or not it's an emergency service and you have to do it, or whether or not it is a non-emergent service, but it is a scheduled or routine transport. So it's a variety of different things. When you look at billing these claims, please remember that you can bill with a GY modifier to Medicare should the VA cover it. So the VA has already paid it in full. You can append a GY modifier saying this should be non-covered so that we do not get a secondary payer under the law. Do you need to do that? Well, no, but sometimes the patient requests it. So what do you do in that case? Well, then you kind of do need to do it, and you kind of do need to bill with the GY. And that would also then allow that should the VA take a payment back, again, you can come back, remove the GY, and see if you can get it to go through the system in that manner as a payable service. So hopefully that answers all those ambulance questions. We'll come back to that. If not, put those back into the chat. All right. That does bring us to the live questions portion. I just realized that there are just a couple that I might not have gone through, and I will go through those and then we'll open for live questions. So I'm gonna have Mary Sue kind of begin to scroll through the chat, pick those out, and then we'll see what we have going on here. So first one is, does the VA follow the same coding guidelines as Medicare? We can't answer that. The VA may need certain codes put into different ways because of how they have service-related or service-connected items. They may also cover anything in general, so we don't know. You'll have to contact the VA. Do they pay the all-inclusive rates for RHCs? We can't answer that. Again, their payment methodology is different. That would also include the CA, Critical Access Hospital payment methodology, which was another question submitted. The next question, we have a retina injection patient that are required to come in monthly. The VA was allowing more than one visit, but recently we have received denials on these claims for needing a new prior authorization number for each visit. What changed and can we fix this? First, we don't know what changed. That's the VA's responsibility to tell you that. We don't have any idea what VA benefit has changed. Here's what we do know. If we do not require a prior authorization for this, or we don't require any other type of thing, and the VA does, if you've billed it and they don't authorize it, or you don't have that authorization number, you can bill Medicare. I will not guarantee payment because we're going to have to look at medical necessity at that point. Next question, why doesn't the VA CCN portal show a range of covered dates, or at least how to find that? We can't answer that. We don't own the VA CCN portal. It's not something that we work with. It's not something that we see. So you'll have to ask that to the person that owns it. Can a patient, we already answered this one, but I'll just answer it again. Can a patient choose Medicare for one visit and then the VA for the next visit? Absolutely, it's their choice. They can choose for some services today and not for others today. So if they're in your office, they say, hey, we want this billed to the VA. Oh, but we didn't get this authorized. Bill that to Medicare. they can do that. So it's not even about one visit versus another visit. It could even be the same encounter. Just make sure you document that properly. Is the VA diagnosis driven for all billing? I would assume that they need a diagnosis for all billing. I don't know what you mean by diagnosis driven. If you're saying if it has to be a diagnosis as connected to a service related type thing, that's not something we can answer. And it really does depend on the patient. Some VAs will say you only, as this certain, you have to go into a VA facility. Other patients do not have that same criteria. So you have to ask the VA what that patient's coverage criteria is. They may say, we will pay for anything related to insert, 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 which may be a diagnosis driven, but we will not pay for anything other than that. And in that case, you would bill Medicare. So it's really up to the VA to distinguish when they have what. And how to distinguish the patient as prime, again, that's a VA coverage question, not something we can answer. At this point, I do want to go ahead and open the floor and see if Mary Sue has any questions for me.
Hi, Tom. I'm just going to go through the questions that came in through the chat. If they're duplicative of anything you mentioned, I'll just let you answer that. But the first one that comes in from Susan, I understand that we cannot bill both, but the VA will tell the patient that they will pay as a supplement. Is that correct?
So if the VA pays as a supplement to something, that is up to the VA to establish. Now keep in mind, if the VA is saying bill us as a secondary, which would be a supplemental coverage, that's a different type of situation, but you'll have to ask the VA how they do that. In that case, if they're saying, hey, Medicare should pay for this first, then you can bill Medicare, and when it gets billed back, depending on what they pay, if you've got over that amount of the Medicare allowed amount, you've got to give money back to Medicare. If they pay the full thing, which does happen, then you've got to give money back to Medicare. So it's a little bit different. If the VA is telling the patient that, I recommend that you contact the VA and find out how it works as the provider and what you need to do with that. I can't really comment on anything more than that with the VA and that situation. Next question.
This one kind of runs along the same, but they said, what if the VA only approves so many days and there are non-authorized days for a stay? Can Medicare be billed for those non-authorized days?
Oh, okay, that's an inpatient care question. And remember, we talked about that. Medicare payment methodology is not such that we bill by day. What we do is we look at a diagnosis and you get a certain amount for an entire diagnosis. The per diem portion of that is a temporary per diem. So if it goes over 30 days, we're going to give you a certain amount per day until that final diagnosis is in. And then based on that final diagnosis, we'll make a payment. Based on that payment methodology, no, you cannot bill Medicare, even if the VA only authorizes 3 days and pays you for 3 days. Because Medicare does not pay daily like that, because our payment methodology is not that same way, we can't do that. So next question.
All right, the next question comes from Jessica, and she asks, if the patient has a VA community care, primary care physician, and there's an authorization, and that person is seen in the clinic for vaccines, including pneumonia, which isn't covered under VA authorization, can the pneumonia vaccine then be billed to Medicare after billed and denied to the VA?
As long as that physician that provided that service is enrolled with Medicare and is allowed to enroll with Medicare. And I do say that because there are certain types of, clinic settings that get into all of that. I don't want to get into the full enrollment criteria, but as long as they are enrolled with Medicare and are allowed to receive payment, then the answer is yes. So the VA can deny it if it's a certain type of authorized outside community care, which we do understand. The community care program says they're not a VA provider, so you would enroll with Medicare. Yeah, we get that. As long as you are enrolled with Medicare, then yes. Next question.
All right. And then Chelsea asked, if the VA pays a claim for a patient, for example, emergency ambulance claim, were you stating that we have to still file the claim to Medicare with the GY modifier to show it's been paid already by the VA, even if we never billed the claim to Medicare per the patient's request?
No, actually, I wasn't stating that. It's kind of the what I was stating is if the patient requests it, then you do want to file it that way. However, if the patient doesn't request it, do you need to file it? No, it's paid in full by the VA. That's a different federal benefit program that's paying it. Therefore, the law prohibits us from paying it. There's no need to file it. But what happens when the patient says, I want both billed? And this will happen. I hope it never does, but it will happen to some of you. In that case, that's where I was staying, put the GY on there and then file it to us, letting us know that it was paid in full. It will go back to the patient under Medicare as a non-covered item, which it is not covered because it is already paid in full by the primary or by the VA, not necessarily primary insurance, but it's already paid in full by another federal benefit program. So hopefully I got that cleared up. If I didn't, whoever asked that question, throw some more information back in chat. Let's see what we got there. And then Mary Sue, whatever our next question is.
And then that's the end of our questions. There was a comment from one participant that the VA does not allow secondary claims. So when we were when you were talking about that earlier, there was one comment that said the VA doesn't allow for that. And that's the end of the question and answers that are in the chat at this point.
All right, well, that means that we went through all the pre-submitted questions. We went through all the questions from the previous education and this stuff. So we're gonna move on. Here we go. That brings us to the end of our presentation. We do have, just a couple minutes left, so we're pretty much right on time here. Want to remind everybody that you will get an email if you signed up with, or not signed up, if you signed in with your email address. For those of you that called in, this is not going to be something that's going to come to you. So I'll give you information on the next slide just as a follow-up here. This email will contain the survey link. Please take the survey. I'll talk more about that in a moment. This email will also contain a certificate. It's called a Certificate of Achievement, and it contains contact hours. The contact hours gives you 1 contact hour for this presentation material today. This is then translated by governing bodies for continuing education units. We do not guarantee you continuing education units for our education. That is up to the governing body to decide. What we will do is give you this certificate. If you did phone in and you do not have this information available, and i.e. we don't have an email address, so we're not going to send you an automated email, you will have to email us asking for that. The email will be given in just a few moments, and we'll talk more about that. Before we do that, I want to remind you that the follow-up questions will also come into the same email. So see where it says follow-up questions in the subject line, you will put Medicare, or VA and Medicare Q&A. We will email those out to you. This is also the same email with the same subject line that you put certificate information for if you called in. Email us. However, in the body, tell us, I need a certificate, and provide us the phone number that you called in with. If I do not have an area code and a phone number, I can't help you. I need that to make sure that you are actually on the call. It is a requirement for us. Once that's said, we will generate a certificate for you manually. It is a little bit more time consuming and a little bit more cumbersome, but we will get you a certificate for that. It's actually going to come out in a Word document. All right, next survey. Please, 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 please take my survey. Give me some feedback here. Survey link in the chat for you. A couple other things to keep in mind. I already told you you're going to get an opportunity in the follow-up email, but don't forget that we're going to give you an opportunity when we close out. It looks like the lower box, it's an external site. Why is this survey so important? Well, it does grade WPS as an overall MAC and tells us how you think we're doing. Great opportunity there. It does look at this education. It is a little bit different with a question and answer section, and the primary goal being to answer those questions. I didn't give a full-on presentation about it, but I did put some slides together to hopefully give you the answers and as reference point to get back to. So hopefully that will help you. I really would like to know if those slides did help you. In there, you'll be asked about the presentation material, and it's really important for me to understand if they helped you, what I could have done better with this presentation material, because a Q&A session is a little bit different than a regular, like just giving you a session. Also, if you are listening in Encore and have a later opportunity, you can also take the survey, and you would use the online survey button. That's going to look similar to what the upper left screen picture there is. So yes, that is available to you. With that said, I just want to remind everyone 2 things. 1, if you want the presentation today, come out to our website, wpsgha.com. Please move to the training center. Go to live events. When you scroll down, you are able to download the same presentation material that I gave you for reference. Okay. We a lot of times get asked, where is it after the fact? We will either remove that presentation later today or tomorrow morning. So you want to be aware of this. Give me a few weeks and we'll put it back into Encore presentations. When you open your Encore presentation, you will see the full blue bar. It'll have today's date, the title. Open that. On the bottom where it says download follow-up materials, that is the same presentation. Those are your two opportunities. Now, again, if you're waiting for it, it might take a little bit to get it, but if you do happen to miss it today, that's what I want you to do. If that does not work and you are unable to download it, again, follow the same directions in the follow-up questions, but your follow-up question is, can you send me a presentation? I can't download it from your website. You can do that as well. All right, so hopefully I got all that information said. Oops, I'm moving the wrong way here. Oops. That's it. That's all I got for you today. So thanks for listening. Thanks for your time today. Hopefully we covered all of the material you needed. Remember, we do want to find more ways that we can help you. Anything that we can do to improve you. Also, take this survey, but include any topics. They do not have to be related to the VA and Medicare at all. Doesn't matter there. So whatever education you would like, we do want to know about it. Please make sure that you sign up for additional webinars one more time. If you're signing up for a webinar, you want the material, you will go to wpsgha.com, wpsgha.com. You will move to the training center. Inside the training center, two different tabs. Sign up for a webinar, download materials from the live events page. That's what this looks like. After the fact, the next day or the day after, you're going to go to YouTube. Oh, I'm sorry. Nope. You're going to go to Encore, it's not YouTube. And then you'll have a player, but you'll also be able to download the material on the bottom. So again, wpsgha.com is our website. I'll have Mary Sue throw a link for that in chat. With that said, on behalf of myself, on behalf of Mary Sue and all of Provider Action Education, we would like to thank you for attending. We look forward to your survey comments and we hope that you'll join us in the future. You may now disconnect. Have a great day, everyone.